Hey health warriors, when a blood clot travels to the lungs it can block oxygen, strain the heart, and become fatal within minutes. Today we're talking about pulmonary embolism, or PE, what it is, how to catch it early, and what to do before it's too late. What is a pulmonary embolism? A pulmonary embolism occurs when a blood clot, usually from the legs, travels to the lungs and blocks blood flow in the pulmonary arteries. Now, most PEs begin as a deep vein thrombosis or DVT in the lower extremities. Once that clot breaks free and lodges in the lung, it becomes a medical emergency. DVT means a blood clot in a deep vein, usually in the leg or pelvis. PE means a clot that has traveled to and blocked vessels in the lungs. Both conditions fall under venous thromboembolism, or VTEL, and are closely linked. Alright, let's talk about the signs and symptoms of pulmonary embolism. You might notice sudden shortness of breath, which can really take you by surprise. Sharp, pleuritic chest pain is another key symptom to watch out for. Your heart might start racing, leading to tachycardia or an irregular heartbeat. Sometimes a cough can develop and it might even produce blood-tinged sputum. Low oxygen saturation is also a common sign. And, well, you may experience anxiety or a sense of impending doom. Now, in more severe cases, things can get quite serious. You might see hypotension or even syncope. Cardiac arrest is a critical concern, and right heart strain can be detected on an EKG or bedside echo. Moving on to the diagnostic workup, several tests can help us identify a pulmonary embolism. The D-dimer test is useful, especially in low-risk patients, as elevated levels suggest clot formation. CT pulmonary angiography, or CTPA, is considered the gold standard for diagnosing PE. For patients who can't tolerate contrast, a VQ scan is an alternative. We also use lower extremity Doppler ultrasound to detect deep vein thrombosis, or DVT, and an ECG might show sinus tachycardia or the S1Q3T3 pattern, although this isn't always present. Emergency management of PE. First things first, stabilize the ABCs, that's airway, breathing, and circulation. If the patient is hypoxic, administer oxygen right away. Next, start IV anticoagulation, typically with a heparin drip or low molecular weight heparin. Now, in cases of massive PE where it's life-threatening, thrombolytics like alteplase may be necessary. For those severe cases, catheter-directed thrombolysis or even surgical embolectomy might be required. Long-term anticoagulation is usually continued for 3 to 6 months or more, depending on the patient's risk factors. Let's talk about some risk factors to watch for. Prolonged immobility, such as after surgery or during long travel, is a significant one. Recent trauma or orthopedic procedures can also increase risk. Pregnancy and hormone therapy are other factors. Cancer, obesity, and inherited clotting disorders are also important to consider. And of course, a prior history of deep vein thrombosis or pulmonary embolism puts someone at higher risk. Always assess VTL risk using tools like the Wells score or Padua score, and act fast when symptoms appear. Pulmonary embolism is a silent killer, but with early recognition, rapid diagnosis, and immediate treatment, it's survivable. Have you ever spotted a PE early or participated in a code? Share your experience below. Your story could teach and inspire others. Like, subscribe and follow for more critical care breakdowns that help you think fast, act smart, and save lives. And remember, think clot, act fast.